Namaste students, Khusro video. I JV'n Dr. NARENDRA, Assistant Professor, Department of SHALYA Tantra, Faculty of Ayurvedic Science, Jayoti Vidyapeeth, Women's Institute, Jaipur. In previous classes, we discussed about anatomy of small large intestine, then in volvulus and cells. In today's class, we will discuss about Crohn's disease. What is the Crohn's disease? It is a granulomatous, non-cessating inflammatory condition of the ileum, commonly end of the colon. Often, it is independent of age, sex, socioeconomic status, and geographic areas. Causes unknown but familial and infective nature is thought. Increased and autoantibodies, diet and food allergy. More common females. Smoking is related to Crohn's disease as etiology and also a triggering factor. Focal ischemia or vasculitis, all are the causes of Crohn's disease. This is the pathology. Firstly, let's begin with the transmural infection, inflammation, then it's converted into granuloma formation with linear snake-like ulcer, cystitization, then thickening of the bowel is called horse pipe pattern, then adhesions and fistula formation. There is an increased mucous membrane permeability that's antigen there, then antigen induced cell mediated inflammatory responses of cytokinins like TNF, interleukin 2 and defective suppressor T cells, then granuloma and other pathology. Fibrosis is stricture formation, deep ulcer and edema of mucosa between their ulcer areas which looks like cobblestone, skipped normal areas in between serosal opacity, mesenteric fat standing large. All these small mucosal aphthous ulcer are less group features. Disease may be inflammatory, stricturing, or perforating types. Non-cessating giant cell tumor is anal fissure is the most common anal problem in Crohn's disease. It may lead into perianal abscess and fistula. This is showing the Crohn's disease. It is a transmural full thickness disease. In 30% of cases, megaclone is involved. Clinical features: acute presentation. It mimics acute appendicitis with severe diarrhea, occasional diffuse peritonitis. In chronic case, first mild diarrhea, colic pain, fever, anemia, tenderness in right iliac fossa. Second stage, in the second stage, either acute or chronic intestinal obstruction due to cystitization with narrowing. Third stage, may fistula formation, enterocolic. These are the clinical features of this. Investigations: plain X-ray. As you can see, there are the findings of X-ray, CT scan, colonoscopy, blood test, MRI. These are the and capsule endoscopy. These are the investigations of the Crohn's disease. Now treatment. Bed rest. This is a medical treatment. Bed rest, protein, vitamin supplementations, often nasogastric tube nutrition, and try TPN, total parental nutrition is required. Steroids are used. Azithromycin is used for maintenance therapy to inhibit the cell immunity. Antibiotics given metronidazole also. Monoclonal antibodies like infliximab also used. Surgery. Indication: failure of medical treatment. 20% cannot be weaned off systematic steroid after 6 months. Intestinal obstruction. Fistula formation, bleeding, malignant change, perforation and problem इनमें अपन सर्जरी एडवाइस करते हैं. सर्जरी इलियोसिकल रिसेक्शन, सेगमेंटल रिसेक्शन, टोटल कोलेक्टोमी or ileorectal anastomosis, stricturoplasty, temporal ileostomy. These are the surgeries. Right hammer colectomy is done occasionally. This is the stricturoplasty can be done in Crohn's disease in case of short stricture in the absence of active inflammation. Complication of Crohn's disease, as you can see, intestinal obstruction, stricture, bleeding, fistula formation, carcinoma, hepatitis, etc. This is all about the Crohn's disease. Okay, students. This digital session is powered by Digital Session 2.0 Jayoti Vidyapeeth 2 months University Jaipur. Hope you are satisfied with this discussion. If you have any queries or doubts, please mention in comment box. I will resolve it soon. Thank you, students.